I'm Melinda Herzog. I am the Healthy Communities Program Leader at Cornell Cooperative Extension of Ulster County. I'm going to ask our co-hosts to introduce themselves. Stacy.
Hey there, everybody. Stacy Kraft, Public Health Education Coordinator with the Ulster County Department of Health, and excited to be here with you today. Thanks.
And Ninette.
Everyone, my name is Ninette Warner. I am the Healthy Schools Coordinator at Cornell Cooperative Extension of Ulster County, and I am also very happy to be here on this lovely sunny day.
And I just want to let everyone know that the meeting is being recorded today. It would be great for you to keep your cameras on, but I also want to let you know in case that makes you want to keep your camera off. But we'd love to see your faces. It always makes the meeting more personal. So, a few housekeeping rules if you haven't been to a Healthy Ulster Council meeting before. The first thing is please say hello by typing your name and your organization in the chat box. That helps us take attendance very quickly and helps others to see who's here. Sometimes when the PowerPoint or we're sharing, we can't see everybody without scrolling. So it's great to see your names go by and your organization in the chat box. Please stay muted throughout the presentations. You will have a chance to share during the networking session. During the presentations, you'll be asking your questions in the chat box and I'll read them aloud and then we'll have the answers to them. But again, you'll have a chance to actually start talking towards the end of the meeting. And today's meeting, we have such a great lineup of speakers. First, we'll have Victoria Reed, who is the Executive Director of the Ellenville Regional Rural Health Network. She'll be speaking about addressing tripping over my tongue today, addressing opioid use disorder in rural communities. And our second presentation will be from Danielle Shuka, and she is the Regional Director of the American Heart Association, and she'll be doing a presentation on stress and your heart. She will also incorporate what's usually our movement session into her presentation, and that will be chair yoga and meditation. That will be followed by our facilitated networking session, and then we'll have some times for discussion and closing. So, without further ado, I'd like to introduce once again our first speaker, Victoria Reed, from the Ellenville Regional Rural Health Network at Ellenville Regional Hospital, who will be speaking on addressing opioid use disorder. And again, I will remind everyone to mute yourself just to be sure that background noise isn't interfering. So, Victoria, I'm going to stop sharing and allow you to share your screen. And we'll get going. And that would be great.
Okay. And everyone can see it okay?
We can see it just fine.
Perfect. Great.
Thank you so much.
Okay. I'm going to be presenting on some of the work we do around substance use disorder, particularly with a focus on our harm reduction initiatives. So I'm going to jump right into that. I do apologize ahead of time. I'm definitely going to cough at least a couple of times. I don't have COVID. I do have bronchitis though. But the pandemic has really shifted our perspective on like bronchitis being a good outcome. All right, so for anyone who doesn't know Ellenville Regional Hospital, we are a critical access hospital. We have 25 beds. We're located in Ellenville. We predominantly serve the town of Warsing, but we also, our service area extends a little bit into Sullivan County, in Wurtsboro in the town of Mamakating, and into Orange County in the town of Crawford. The total population of like the area that the hospital serves is about 35,000 people, but the population of the town of Warsing is about 12,900. And the town of Warsing is a rural town. It's designated medically underserved population. And then the town of Mamakating and the town of Crawford are also both designated as health professional shortage areas. So all of the populations we serve are pretty high need. A very high ratio of Medicaid, Medicare, about 65 to 70% of the population that we give services to each year have either public insurance or no insurance. And people who live in the town of Warsing face a ton of barriers to accessing healthcare and community-based services. I don't think this is new to anybody on the call. I think everyone's probably had 1,000 presentations on data in the area. So I'm going to move forward with that, but glad to touch on anything if anyone has any questions. So the Ellenville Regional Rural Health Network was started in 2017 through a HRSA planning grant with a partnership that the Ellenville Regional Hospital, the Institute for Family Health, and the Ulster County Department of Health entered into to apply for that planning grant, and then subsequently applied for an implementation grant. All the staff of the network are embedded at Ellenville Regional Hospital, though all of the founding partners and a number of other partner organizations often are subcontracted through the grants to provide additional work to the network and the communities we serve. The mission of the network is to continuously pursue healthier lives for everyone in our community, and our future vision is that our communities will thrive, be healthy, and be well, and individuals will want to live, work, and play here. So the Rural Health Network, which I serve as the executive director of, is really responsible for a lot of the community-based side of our health initiatives. So many people know Tanya, she works for the Rural Health Network. And so all of our kind of peer work, our harm reduction work really is embedded in the Rural Health Network. So for those of you who aren't very familiar with what we're saying, the population number is a little off. It's actually 12,900, but the median age is about 42 years old. Our median household income is just over 48,000, which is significantly lower than the rest of Ulster County. About 17.9% of people live below the poverty line, and about 30.2% have Medicaid coverage. We're about 45 minutes outside of Kingston by car. Really can only get there. There's a couple ways, but mostly 209, which is the same way the UCAT bus line runs. But the bus is very limited. If you're taking the bus to get to Kingston for services, you're pretty much going to lose a whole day. And then it's not very comfortable for seniors. So it's really challenging. And then given the weather too, anytime you're trying to travel out of Warsing, which is situated between two mountain ranges, even if you have a car in the winter, everyone here knows what the winter is like. We have significantly limited taxi services. We have about one taxi that serves for Medicaid taxi, and it typically doesn't even show up for people. So if you leave our hospital, if you're familiar with the hospital, it's on ShopRite Boulevard. It's off ShopRite Boulevard. So if you're coming down 209, there's a big electronic sign, and that you turn in to come to the hospital. If you ever drive by there, you'll frequently see people standing underneath the electric sign because the Medicaid taxi just didn't come for them. And it also won't come to the front of the building. They have to go wait up there for it. So lots of transportation barriers is predominantly the issue. These are opiate fatalities in Ulster County for the past few years. I think this is a graph that most people are pretty familiar with. We had a decent improvement, or I should say a reduction in fatalities in 2019, but then given the pandemic, the numbers has continued to skyrocket, though the pace for 2022 so far is looking more hopeful than the past 2 years. So Ellenville started its work with around substance use disorder under the DISRIP initiative in 2015 in partnership with the Institute for Family Health. They participated in a Medicaid accelerated exchange project, which was just called MAX project. And through that, our goal is really to reduce the number of opiates that we were prescribing, because we acknowledged that the rate of opiate prescribing was contributing to the epidemic. So we over the course of those 4 years, when we would see people in the emergency department, we would really rely on alternative pain management methodologies, like referrals to like chiropractors, physical therapy, primary care doctors at the institute, care navigators, to look at different options. And so we basically stopped prescribing opiates in our emergency room. Less than 2% of all patients in our emergency room receive or administered an opiate prescription or dosage in our emergency room. We continue that practice today, although the official monitoring of the project did stop in 2019 when we moved into our next phase of our opiate response work, which was Project Rescue. Project Rescue is an acronym. It stands for Revive, Evaluate, Suboxone, Connect, Uphold, and Effect. It's basically just 24/7 ED-based access to medication-assisted recovery. A lot of times people call it medication-assisted treatment. We call it recovery because it's more person first, because continuing to call it treatment after people have utilized buprenorphine for years and years and years fails to acknowledge that they've actually moved into recovery. And given there's a lot of stigma around the use of medication in the recovery community, we just feel like it's more person first to call it recovery instead of treatment. And the overall goal of the project was to reduce opiate fatalities by providing immediate entry and access points to MAR by offering a 24/7 RED. So we started with a PDSA from January to March to really design the program. And then we launched it in April of 2019 after receiving funding from OASIS. And so with the PDSA, we built a framework where anyone who presented to the emergency department showing signs of withdrawal or post-overdose would be screened for their withdrawal symptoms using the COWS scale and evaluated. A lot of times when people self-present, they might rate like a 1 or 2 on the COWS scale. But instead of sending them home, we know that they're going to get higher on the scale as time progresses. And if we discharge them to get higher on the scale of their withdrawal on their own, they may return to use to alleviate their symptoms. So if people score pretty low, we still will let them stay in the emergency room, given our capabilities with the pandemic and everything. But for the most part, we'll let them kind of stay until their withdrawal gets more severe so that we can induct them on buprenorphine if they want, or more frequently as of late, we will arrange for them to move into treatment right away so that they don't have to wait for that to hit, so that they can already be a treatment facility. COVID has thrown a lot of wrenches and things. There's more wait times and stuff like that. But Danielle and Tanya do a pretty good job navigating the system. So the purpose of the plan is if somebody shows up to the emergency room and they are in withdrawal, we will offer them buprenorphine, we'll screen them, make sure they're a good candidate, administer buprenorphine based on their needs. And then we can continue to administer buprenorphine for them for up to 72 hours. If the provider is not waivered. So some of the recent health actions that have come out of the administration have murkied this a little, but for the most part, emergency department providers who do not have a data 2000 waiver can administer buprenorphine in an ED setting for up to 72 hours. Some of our providers are waivered and are able to write a script for if people say like run out of their medication, or they lose their medication, or just whatever happens, and they need 3, 4, 5 days to get held over. Our providers will evaluate if it's a good fit and then write them a script, or say we have a lot of people who come to us who don't have insurance and they need to get insurance to get into treatment, and we have an insurance enroller who can help them with that, but it'll be like a week or 2 before they can get into the treatment facility, so our providers will write them that bridge script. And so based on the client's individual circumstances, we'll determine if it's better to administer those 72 hours in person or give them the script. There really is a person by person. At the time of our PDSA, all of our providers were waivered. We have had some staff turnover, so we don't have quite as many, but we did make an effort to waiver everyone. So like I mentioned, we received funding from OASIS to officially launch our project. We had partnered with Catholic Charities of Orange, Sullivan, and Ulster to provide ED-based certified peer recovery advocate services. So when someone came in, we would give the on-call peer a call, and they would either come in person or talk on the phone with the person. Since then, we've progressed to having the project funded through HRSA under an R Corp implementation grant, which we have many more partners for. We still provide 24/7 buprenorphine induction, eliminating the wait times and improving access to treatment with the connection to certified recovery peer advocate. One thing to note is, actually, I'll note that later, sorry. All right, so currently, in addition to offering those buprenorphine inductions, we are also offering the bridges. A lot of the work that Tanya and Danielle ends up doing is actually treatment navigation, navigating the whole treatment spectrum of inpatient, outpatient, who accepts my insurance, where can I go, how can I get there, is tremendously difficult. Tanya and Danielle do it for a living and they do it every day, and still sometimes it takes them a week to find a place for someone. So for someone who is not intimately familiar with the system, doesn't personally know the people who work at the facilities and have their cell phone numbers to text them or call their direct office line, it's almost impossible, especially if you're a family that's dealing with, you know, a crisis of having a loved one overdose or you're in withdrawal. So a lot of the work they do really is about navigating. So if you know someone or family who has someone who is experiencing substance use disorder who needs to get to treatment, put them in contact with Tanya and Danielle. So what they're really good at is, you know, finding those treatment channels to get people in as fast as possible. In addition, we offer a lot of harm reduction services because not everyone that we treat is ready to move in or, you know, interact with is ready to move right into treatment. So we do offer virtual Narcan trainings the first Wednesday of every month. It's really important to get Narcan out in the community, especially as we see the increase of fentanyl and other substances besides heroin. And with the, you know, high rates of prescription medication still existing in rural communities. We do monthly sharps collections and medication collection days once a month. We also have a permanent medication collection box that people can access at any time and distribute medication disposal packets. We also hold a monthly GRASP group, which stands for Grief Recovery After Substance Passing. That's a peer-based, it's run in a peer capacity. So it's for people who have lost someone to substance use disorder. And it's not it's not like staff run, it's run by people who've also lost people. So that happens virtually for now, and is open to anyone who is in need of that. You may already be on the email list for it, but starting back in March 2022, when the pandemic really hit us hard, Danielle and Tanya started calling all of the treatment facilities in the area to find out how COVID was impacting their offerings. A lot of places had to cut down on their beds or cut down on their hours or change things. So since then, every 2 weeks, Tanya emails out a list of all the treatment facilities and what their availability is currently, or if they have any like COVID protocols that are changing their availability. If you offer services and you're not aware of this list or on it, feel free to reach out to Tanya. Her email will be at the end. I will say this is it's like passively updated. So if you see the list and you're like, hey, my information's not right, it's probably not right because you didn't give it to Tanya. So it's a lot for her to manage. So if you want it updated, reach out to her or Danielle. Through the HEAL initiative, we also created the Ulster County MOUD website. I believe these slides will get shared, so there's a clickable link in there, but I'll make sure that link gets out to everyone where you can go and find all the treatment resources to access MOUD on that website. And then Tanya's also in the process, she may have finished it before she left for vacation, of embedding an individual Narcan training video into the MOUD website. So anyone can go on that website, watch the training video, and then request to get a Narcan kit. So we've really been trying to flood the community with Narcan. So far, all of our buprenorphine inductions since 2019 have all been of people who have heard about the program, no one who was post-overdose. So it's all been people who elected to come in when they were in withdrawal, specifically to access medication-assisted recovery. So some of our harm reduction initiatives, so like I mentioned, we have not inducted anyone post-overdose. So a lot of times when we see people post-overdose, we're giving them harm reduction supplies. And that's typically how they hear about the program and then eventually come back to work with Tanya. So this is what our harm reduction bags look like. These are actually lock bags for medication. And then we stuff the bags with naloxone, fentanyl test strips, safe use and snoring kits, and then a ton of community resource information like the mobile mental health magnets, different brochures for treatment providers, for phone lines, the Oracle phone line, things like that. If you're hearing this and thinking, hey, I should have resources in that bag, again, email Tanya and, we'll get it in there. It's just meant to be like a really good resource. And we give these both to law enforcement and to the emergency department so that if law enforcement respond to an overdose, they can provide that to either the individual themselves or a family member or a friend on the scene, and they can use it to get in contact with resources. This is what is in our Naloxone Kit. If anyone has not seen a Naloxone Kit before, we have gloves, direction booklets, safety plan booklets, the nasal spray, a breathing mask, and this card with the QR code to request a new kit. And this is our safe use kit for injecting. It includes a Band-Aid, alcohol pads, antiseptic wipes. These little tiny things are cotton balls. This round circle that says Big Otters is a compressed towelette. So when you wet it, it actually opens up into a whole towel. There's sterile water, and then there's cookers in it. And we receive these through Hudson Valley Community Services so that we can provide them to individuals in the community. A lot of these are provided either through those bags or through direct street outreach. These are safe snorting kits. So they contain straws, plastic razors, a plastic PVC card, plastic makeup spoon, and 2 fentanyl test strips. A lot of times people ask us, or at least I know I see presentations, I'm like, that's cool, how'd you afford it? We actually spent $50 to make 200 of these kits. So a lot of times if you're just really resourceful or creative, that can help. Like we got big straws and cut them down, because if you buy little straws, they're more expensive. So yeah, just being kind of creative. And then Tanya made these cards about how to use fentanyl test strips and how to use a safe snorting kit, because if we bought cards, again, like really expensive to buy instruction cards, but we can make them for a huge fraction of the cost. These are medication disposal supplies. We have some of the larger drug deactivation system bags, which you can fit quite a bit in, and those are provided to us through Catholic Charities. And then we also have the smaller DisposerX packets that get poured right into the vial. We received an Amerisource Bergen grant. It's actually a super easy grant to apply for. If anyone is interested in looking into it, you just go to their website and you just write why you want it in this like fillable form. And then like 2 weeks later, they were like, hey, how many do you want? And they sent us 5,000. So that was awesome. It was the easiest grant application I've ever written, which was more awesome. And then they sent us a few of these cards. So then we just scanned the cards and printed more out instead of ordering like the hard copy of the cards. And so since then, we also purchased a few more, and then DisposerX, the actual company, gave us a small grant for another 400 packets. And then we received a donation from someone in the community to buy some more. These are some of our other harm reduction supplies. These are our fentanyl test strips. Our original batch of them was purchased by our local EMS agency as a gift to our network. And then we also got a donation from a community member to buy more of them. And then the federal government actually changed their policies and started letting us use HRSA dollars to buy them, which was awesome. We hand out sharps containers. Hudson Valley Community Service provides us some sharp containers, and the hospital also purchases more because the hospital, we have to collect sharps. These are some of the pill lock boxes that Catholic Charities gave us. And then these are condom kits or safe sex kits. We do get some from Hudson Valley Community Services as well, but we also get a whole bunch of them from Planned Parenthood. And so I think the lesson there too is to keep in mind kind of non-traditional partners. When you're thinking about substance use, Planned Parenthood isn't probably the first organization that pops into your head, but they did give us 200 safe sex kits to pass out to a community that is especially high risk of the spread of hepatitis C or HIV or other infectious complications. So that is helpful. And then, sorry, I'm just reading Tanya's notes. Tanya is very lucky. She is at a water park this week, so I'm presenting for her. But she did say to mention that one nice thing is we had 2 individuals who had come into the hospital. The first part of the story is not nice, but the second part is they were at a party and they had seen someone overdose. And then another member at the party ran out to their car and got the green bag that we had actually given them and revived the person and saved them. And so they had asked the person about like where they got the bag, and they came into the hospital and they requested bags for themselves. So it was nice to hear that, you know, the bags are being used and actually saved someone's life. Very often you don't get reported back that information. And right now, Tanya is in the process of pricing out safer smoke kits, which will include sterile glass pipes, little packets of antibiotic ointment, antiseptic towels, vitamin E lip balm, rubber mouthpieces, alcohol wipes, stainless steel filters, and poking tools. The most expensive piece will probably be the glass pipes. But again, you know, we're shopping them out from different places to kind of piece them together in a cheaper way. And then those will also be able to distribute. Other harm reduction resources that people are able to access that aren't through us are Next Distro, which is a mail order harm reduction supply and does also distribute syringes if people need them. And then there's a website called Never Use Alone that people can call while they're using to help prevent fatal overdoses. And this is me and Tanya's contact information. We also are available to do harm reduction and Narcan trainings for organizations. We spent a lot of time going out to the businesses in our community to do Narcan trainings and provide them with Narcan, which originally they were hesitant to, but the reality of the situation is people are using in the bathrooms of local businesses, and you know, they need to be prepared for it. So and then through the HEAL grant, there are also Naloxone boxes. So if you at your organization or a local business think you'd be interested in having a Naloxone box, which is basically just a case that you mount next to your AED that has Narcan in it, you can either reach out to Tanya or to Jillian at the county, and she can help you out with that. So that's all I have, and I will turn it over for questions if anyone has any.
Yes, I'd like to remind everyone to put your questions in the chat box. And while you're typing, I have a question. You spoke about, you know, the experience that you have assisting families, especially to put them into treatment centers. You're serving a certain geographic area around the Ellenville Hospital. Would you serve, you know, larger Ulster County with some of these issues?
So the service area that I was describing is really like the hospital's traditional service area, but Danielle and Tanya have gotten calls from people in Rockland County, in Pennsylvania, and Connecticut. You know, the system is really hard to navigate, and when families, you know, find that resource, they do, you know, reach out to us. So yeah, we really will help anyone who calls. We're not, you know, going to turn any away. There are occasions where if, you know, someone's calling from a certain area in Orange County and we know Catholic Charities would be better suited to handle them, we'll bridge them on with Catholic Charities, or have someone from Catholic Charities call them and follow up and make sure they connected. But for the most part, anyone who calls or anyone who shows up will help.
Great, thank you. One other question I had, and that was just looking at your statistics, you know, clearly pandemic related. I think that's happened around the county and certainly the region. Has there been any major changes in the way that you're addressing the program in this year to try to, you know, kind of stem that increase in opioid mortality?
Yeah, so a lot of our programs we had to transition to virtual, but we're able to start transitioning a lot of them back into in-person. In the past year, we have done a lot of work. I didn't even really touch on this in the presentation, but we've done a lot of work with the high-risk mitigation team. So the SPOA team through the county and the Oracle team through the Sheriff's Department, and then Catholic Charities, Samadhi, and Hudson Valley Community Services, Independent Living, all the peer-based agencies have all been meeting together to do basically SPOA style services for individuals who use substances, to try and make sure that we are engaging them when they're vulnerable for an overdose rather than waiting till after an overdose to respond to them. And so looking at those events where they're, either experiencing an overdose, they're being discharged from a treatment facility or incarceration, or they miss an appointment, they leave AMA from an inpatient facility, those type of issues where events which would make them more vulnerable, and then contacting the peer who is assigned to them to make sure they're getting to them right away and getting them those harm reduction supplies as coaching, or trying to just kind of problem solve treatment barriers. So if someone missed an appointment because they didn't have transportation, trying to, solve that, or if they missed an appointment because it was too early, maybe it's just that we need to communicate that their appointment needs to be later in the day or something. So that's one thing that we're working on this year, that we're really hoping to drive down overdoses there. And then over the past year, we've really expanded our harm reduction efforts and really made sure we're getting a lot more fentanyl test strips. The reality is, for the most part, people are not using just heroin anymore. I can't even think of the last time someone came into our emergency department and heroin was the only thing they were using. Substance use disorder is predominantly co-occurring. And so it can't just be a one-step approach of, just buprenorphine is the answer. We have to have a whole series of harm reduction supplies, including, and that's why we're moving into the safe snorting kits and the safe smoking kits and the fentanyl test strips, and a lot of education around the fact that fentanyl is in a lot of substances, and making sure that we're getting people into the right level of treatment, and that we're not sending them somewhere that just does outpatient buprenorphine treatment if they're co-occurringly using multiple substances.
Well, thank you very much. Very impressive work. Do we have any other questions? Does anyone have any that they'd like to put in the chat? I'm reading from Kushbu. Thank you, Victoria, for such wonderful informative presentation. She has a question regarding smoking tobacco consumption. Do you frequently see tobacco addiction along with other SUDs?
Yeah, so tobacco, we do, of course. In terms of like how we respond to it, it's kind of the smaller fire that like for sure we want to put out, but if we have people who are taking benzodiazepines and telling us they're using straight fentanyl, adding tobacco cessation is a stressor that probably that person cannot handle in the moment. And we got to look at what's the most immediate risk of fatality. And then, if we get to a point where we, can help that person quit smoking, wonderful. We would love to do that, obviously. The Rural Health Network also has a chronic disease side where we work on cardiovascular disease, obesity, diabetes, and tobacco cessation, and in like a health capacity. But when it comes to substance use disorder, it's kind of like picking your battles and trying to prevent fatality, and then later down the road, moving into what's healthiest.
Yeah, I would imagine that maybe you could connect afterwards, but it might also be a question about statistically, are you seeing more smoking? Like, you know what I mean? Are they also smokers?
Yeah,
that might be
so
a
the
question
population
as well.
of people who have behavioral health conditions traditionally, and we do see it in our population, do use tobacco more at higher rates than people without.
Thank you. So our time is up for a presentation on opioids. We'd like to move on into our next presentation. And thank you so much, Victoria, and thank you for stepping in for Tanya on short notice. We really appreciate that. And we just want to introduce next Danielle Shuka, the Regional Director of the American Heart Association. She's going to be speaking to us on stress and your heart. So I will stop sharing and open it up for you, Danielle, to share your screen and share with us.
Perfect. Are you able to see mine okay?
Yes.
All right, awesome. And thank you so much, Victoria, for sharing all that. I feel like I need my presentation more than ever after hearing yours. But thank you guys for inviting the American Heart Association here today. As we start this part of the afternoon, I just want to encourage you to be open-minded to the presentation. And if you haven't already been able to find like a quiet spot, either in your office or home, just stick with me for the next 30 minutes and we'll see if we can't help reduce your stress a little. So I want to preface my presentation by saying, yes, I work for this amazing evidence-based research organization, and I have all of these resources right at my fingertips when it comes to being heart healthy. And I occasionally teach adult and kids yoga. I do have a third grader who is involved in a lot of activities and a husband who has a demanding job in New York City. So I wanted to just give you a little background on me so that you understand that I am by no means an expert in managing stress, but I do try. And I think that that's something that we can all do with the right tools. So what we're going to start this presentation with is a short meditation. So go ahead and just like find a comfortable seat in your chair wherever you are. And then take your gaze low, or maybe even closing your eyes, whatever you're comfortable with, and recognizing that you are in a safe place for the next few moments. And we're just going to try to find some calm and release. So pay attention to where your sits bones meet the chair that you're sitting in, or the couch or the floor. Visualize your spine nice and long from the top of your head all the way down, reaching from the bottom all the way up to the ceiling. And then just check in and make sure that your head is in line with your shoulders, and maybe just so slightly tilt your chin towards your throat, releasing any tension in the back of your neck. And then let's collectively roll your shoulders all the way up to your ears and back down, release it all. And one more time, all the way up to your ears, and then release. Feels so good. And then just visualize your heart coming forward, your chest opening, and mindfully press your feet into the ground. And just notice for a moment how you're coming to this pause in your day. I'm guessing it's not easy for everybody to do, but let's just take a moment without judgment and just observe where you are in your day. And then start to notice your breath and the flow of your breath in through your nostrils, into your lungs. Visualize the oxygen filling up your lungs and then releasing it slowly. Mindfully release any muscles that you have tensed right now, or energy that you're holding in your body that's not serving you. And if you do feel any tightness, just send your breath to those areas to release. So really visualizing your breath healing any discomfort that you're feeling in your body. And we'll practice a short box breath breathing. And it's a technique that you can use anytime to calm your parasympathetic nervous system. And I'm going to cue you, but feel free to go at your own speed. But we're going to breathe in and count to 4. So breathing in 1, 2, 3, 4. At the top, just hold your breath for a moment. 2, 3, 4, and exhale. 2, 3, 4. And after the exhale, hold for a moment. And then again, inhaling for 1, 2, 3, 4. Hold. 2, 3, 4. Exhale. 1, 2, 3, 4. And hold. 2, 3, 4. And just continue at your own pace for the next few moments, counting the breath in, holding at the top, exhaling fully, and holding at the bottom. Nice. And just letting go of any thoughts or energy that is not peaceful to you. And anytime during your day that you feel like you need to just check in with your breath, it definitely helps re-energize me, and I think it'll re-energize you. So when you're ready, go ahead and blink your eyes open if they are not already. And we're going to take that activity break. So maybe scooching back from your desk just a tiny bit, coming to the edge of your chair, your shoulders way up towards your ears again, and release them down your back. There you go. Now take your right ear and release it down towards your right shoulder. And anything that we do in the next few moments, make sure it's comfortable for you. Don't do anything that doesn't feel right. And on your inhale, lift your head back up to center and then release your other ear down towards your other shoulder. Breathing into the side of your neck, giving it a break, and back up to center. And then slowly start to look up towards the ceiling, stretching out the front of your throat. Inhaling and exhaling. And on your next exhale, release your chin down to your chest, release your shoulders down, and give the back of your neck a nice stretch. And come on back to center. And then with your nose, just draw a circle. So up towards the sky, over to the right, down towards your chest, over to the left. And just continue with these circles, big or small. Visualize your nose drawing that circle. And then take that circle in the opposite direction. Nice. And when you're ready, come back to center. And with a little bit of room, you're just going to breathe in and lift your arms up towards the sky. Nice. And on your exhale, breathe nice and let everything go as you float your arms down to your side again. On your inhale, lift up. On your exhale, release. And really using your breath. So inhale as high up as you can go, reach towards that ceiling, and on your exhale, let it all out. And 2 more times using your own breath. Inhale, arms up, and exhale your arms back down. Nice. And then let's go ahead and opposite shoulder roll. So one is going back at a time. Just find some fluid in your shoulder joints. And then take those circles in the opposite direction, bringing them forward towards your screen. Nice. And then when you're ready, go ahead and stop in the middle. Lift your arms up to the sky again. This time, take your right hand across your body. Your left hand can come to the back of your chair, to the arm of your chair, and just twist to your left. Inhaling and exhaling. Nice. And then come back to center, pause for a moment, and then we'll lift our arms up again. Left hand comes across your body, right hand goes behind you to the back of your chair, to the arm of your chair, and just twist to your right. Nice. And then back to center. This time we're gonna lift our arms up overhead. Right hand, your right hand takes your right wrist, and then gently just bend over to your right, creating a half moon or C with your body. And only going as far as your body allows right now. Excellent. And back to center. Release your arms down, just shake those shoulders out. And when you're ready, lift your arms up, taking the opposite hand to the opposite wrist, and then bending over to the opposite side. Inhaling and exhaling. And then release. And then go ahead and sit back in your seat ever so slightly. And if it's possible for your body, take one of your ankles and cross it over your opposite thigh, making a figure 4 with your legs. And then just gently, just opening up your hip by mindfully putting a little bit of pressure on that bent leg, on that bent knee, flexing generously through your feet, grounding into the foot that's on the floor, sitting up nice and straight. And if you feel like this will suit your body, just go ahead and bend forward ever so slightly, releasing any tension you're holding on to in the lower back. Using that breath. And then coming back up to a seat, releasing that leg that's crossed over, and just pausing for a moment before taking your other ankle and crossing it over your opposite thigh. And again, just putting ever so slight pressure on that bent knee, creating that figure 4, engaging your belly. And if you would like, just releasing from the torso forward with no destination in mind, just folding, opening up the hips, releasing the lower back. And then exhale, replace that foot back on the floor. Put your hands right on your thighs. Let your shoulders release down your back. Tilt your chin down towards your chest. Bring your gaze low or close your eyes. And just one more time, take a nice inhale, filling up your entire lungs, filling your lungs up entirely. And on your exhale, if you're comfortable with it, just letting it all out of your mouth. And one more time, inhaling through the nose and exhaling through the mouth. Awesome. So nice and slowly, you can make your way back to your computer or your desk. Go ahead and turn your camera back on if that works for you. And I just want to share that that short sequence was, doable for a lot of us, and it's something that you can really do at any point during your day. It felt good for me, and it helps just alleviate, any stress that I'm really feeling in the moment. So I hope that you'll utilize breathing and also mindfully breathing and doing short exercises during your day. So we all know that being well is so important to our overall heart health. Be Well has been a part of the pillars of health at the American Heart Association for a long time. However, over the last 2 years, it's now one of the priority areas that the American Heart Association is putting resources behind and a lot of research money. Our goal is to help all Americans live longer, healthier lives. And we know that that looks a lot different now in the world that we're living in. Stress. Go ahead and maybe type in the chat just something that brings you or causes you stress. Stress is that state of mental or emotional strain or tension resulting from adverse or very demanding circumstances. And actually, I asked you to put it in the chat, but I don't know that I can see the chat. So I'll just share that, some stresses that we hear from people these days are certainly their health, their children, finances, friends, work, the state of the country, the state of the world. Is there, let me see, maybe I can see. Yes. Yes, the snack game is real for kids. Deadlines for sure. hearing people argue. Oh, we're going to talk a little bit about that. And absolutely, other people's energy certainly has the ability to stress you out. This is just a meme that I found that I think is so funny because it's so true. It's trying to excel in your career, maintain a social life, drink enough water, exercise, text everyone back, stay sane, survive, be happy. I don't know about you guys, but having like multiple email accounts and trying to stay on top of everything can definitely be stressful. But the research says that there is a connection between mental and heart health. So let's take a moment to just identify what happens when you feel stressed. So some people turn to smoking, drinking, drugs, or eating fatty food. I know that when I'm stressed, my body usually craves like chocolate or something quick to fill the space that feels uncomfortable. The idea is that we identify the feelings and we process them accordingly versus just filling the void. I also saw quarantining from daycare. I think that that is something that is like new in our life, and we have to figure out how to manage those stresses, which is of course much easier said than done. So increased cortisol in women often ends up around our bellies, which is unhealthy for our organs. And specifically, the more extra weight we carry, the harder our hearts must work. So maybe again, I'm sorry, I can't see everybody, but maybe just a show of hands. Does anybody on the call know what their blood pressure is today, or this past month? Have you had your blood pressure checked? If you do, let's see those hands. And I can only see like 4 people, so thank you for those who did raise their hand. But blood pressure is a really, oh, there we go, thank you guys, is what we call the silent killer. So most of the time there is no obvious symptoms for high blood pressure, but certain physical traits and lifestyle choices can put you at greater risk for high blood pressure, and in turn causing a heart attack, a stroke, heart failure, kidney disease, vision loss, the list goes on. Stacy has been fantastic in sharing a free program that the American Heart Association is doing right now. It's called the Check It Challenge. There is no fee to participate. It's really about empowering individuals to know their blood pressure. It should be somewhere around the 120/80. And the idea is that if you know what your blood pressure is, you can, when you check your blood pressure, you can make lifestyle changes or possibly medication changes so that you can control high blood pressure before it causes problems. I do have a quick story about heart rate. I have a friend who's 48 years old, in relatively good health, no prior history of anything with the heart. And in January, he was riding his Peloton, and it said that his heart rate was, off the charts. He got off the Peloton, took a rest, and his Apple Watch actually told him he was in AFib. And I think that there is real value in just knowing that a high heart rate is something that needs to also be controlled. Thankfully, he's on medication now and working with his doctor to make even more lifestyle changes. But when you're thinking about overall stress and the things that are the ways that it affects your heart, your blood pressure and your heart rate are definitely part of that. So keep in mind that those are just as important to track. So today we'll review a few ways that can help keep those cortisol levels low, and in turn keep your heart fit. We're going to talk a little bit about energy boosters, gratitude, and meditation. So the American Heart Association released these 5 ways to boost your energy. The first one is moving more. And let me just look in the text box here. Then Are you trying to steal my presentation? I think you just added at least 4 of these. But we have increasing movement for energy. It seems like a little bit counterintuitive, but in the long term, it really works. So just starting where you are and doing more. The American Heart Association recommends 150 minutes a week of moderate aerobic activity. And the idea is that once you start, you'll have a momentum. You'll catch a momentum and you'll just keep it going. The important takeaway for this is that moving more doesn't mean spending hours at the gym. It means just moving your body. So that can be with something fun like a Zumba class, a yoga class, a Peloton or a bike ride, or even walking. And I think that walking is sometimes overlooked because it's something that we do pretty regularly. But if we're actively walking those 150 minutes, you'll really see a boost to your energy. Eating smart, eating a variety of fruits and vegetables. They're good for your body. Consider eating smaller amounts and more frequently nutrient-rich meals that'll help balance your blood sugar, helping you feel more alert. So caffeine and sugar can lead to energy spikes, but then they can also have those crashes. So we encourage everyone to drink lots of water and switch out those sugary sweetened beverages for infused water, maybe with a little bit of lemon or a cucumber. Make it fun, make it your own. Also, we say sleep. Sleep is so detrimental to your health, and I think it's something that we often don't even think about, but our body needs that time to rest and regenerate. I do have a poll here, but I'm going to just say, let me see a show of hands of how many people on this call are getting between 7 and 8 hours of sleep a night. 7 and 8 hours of sleep. Nice. That's awesome, because that is the recommendation for how much sleep the average adult needs. Kids need even more than that. And ultimately, there are certainly ways that if you're not getting enough sleep, that you should look into, whether it is turning off screens before bed, reading or listening to a book on tape, or one of those apps that have calm or meditative qualities that will help you fall into that sleep. It's really important. And then carrying around extra pounds zaps energy. So, and it becomes, like I mentioned, extra work for your heart and can raise blood pressure. So eating healthy and exercise will ultimately help you burn more calories and in turn lose a few pounds. And then the last bullet is lightening up. And we're going to spend a little time today talking about how we can do this. And I agree, Isis, this is definitely a perfect world. But sometimes I think that when you hear things maybe a little bit differently, or maybe at the right time, it can affect change. So we are talking about like best practices, and when you're ready, trying to make those small lifestyle changes so that they are sustainable. So lightening up, learning how to manage stress and keep a positive outlook will help fight energy zapping depression. Life has been really heavy lately, and lightening up your energy can have so many positive effects. So we're going to try 2 ways today. Thankfulness and how gratitude can help your health. Have you ever felt like you just can't catch a break, or do you feel like you're around a lot of negative people? Or I think somebody mentioned earlier, hearing people argue, or just cynical about life. Negativity is contagious, and it can take you down a hole that can be hard to get out of. So combating that with staying grateful is really important. And they say that if you can't be negative and be thankful for something at the same time. So you have the decision of what you want to do. So I'm going to encourage you to try to be grateful. So some neuroscience experts think that our brain focuses on negative information as a way to remember pain so that we can avoid it in the future. And stay safe. And they call this negative bias. But to balance this out, that's when we practice gratitude. So we are going to do a short activity. If you're able to, please grab a piece of paper and a pen or a pencil. And if you just have your phone or your computer notes open, whatever you can just type out or write out. In the next few minutes, we're going to do a 5-minute gratitude. 3-minute gratitude. So your health. Thinking about one thing that you are thankful for your health. So we take about 8 million breaths a year. You can be thankful for your feet that help you walk, or your arms that help you write. Just pick one thing about your health that you can be thankful for today. And then something that you like to eat. We eat a lot of meals. If you eat 3 meals a day, you'll eat about 1,000 meals this year. So let's just take a moment and be grateful for something that helped fuel our body and our mind. And then activity. So what's something on your to-do list that you don't mind doing? Just write that down. What is it that you don't mind doing every day? Maybe it's taking a shower. Maybe, excuse me, it's getting your kids off the bus. Just find that one activity that you do in your day-to-day life that you can be thankful for. And then relationship. Who is that one person that just you look forward to seeing? Take a minute and just smile as you think about a person in your life or a relationship that you have that is a positive one. And then finally, time. So, every day we wake up with the same 24 hours. What is it that you can be thankful for the gift of time, something that you've had time to do? And then I would just encourage you, as those negative feelings creep up throughout the day, which they will, to just refer back to this list, or have a practice, a regular practice of writing down, either capturing in a notebook or on your phone things that you are grateful for. Ultimately, though, we know that life is about balance. So some days you'll have the perfect plan for the most productive day and everything will just go wrong. Some days you'll feel like you're drowning and somehow you'll get a lifeline out of nowhere. Know that neither one of these are sustainable, and that balance is what happens in the middle. And a mindset of flexibility is really key to staying happy and stress-free. Life is ultimately full of ups and downs, and sometimes you have to stop and remember that you can't appreciate the ups unless you experience the downs. And then practicing mindfulness and meditation may help you manage stress and high blood pressure. It'll help you sleep better, feel more balanced and connected, and even lower your risk for heart disease. Meditation and mindfulness are practices, though, and often using breathing and quiet contemplation and sustained focus on something, maybe an image, a fire, a flame, a phrase, or a sound. But recognizing that you don't have to twist yourself up in a pretzel to meditate. It's really just about taking a quiet moment and focusing on your breath. Recent studies have offered promising results about the impact of meditation in reducing blood pressure, and there's also evidence that it can help people with insomnia, depression, and anxiety. Just like I said, sitting quietly and focusing on your breath, and also finding the meditation that works for you. We did a short one earlier with box breathing. That may have worked for you, but maybe it's not that. Maybe it's alternate nostril breathing, or maybe it is lion's breath breathing. But try different things and see what works for you. You can do that by exploring different apps. YouTube, Headspace are a few. There's also a meditation called Love and Kindness meditation. I would just encourage you all to look this one up. It just suggests that you can boost your empathy and feelings of connections with others and reduce your negative bias, anger, depression with this meditation. So just take that deep breath in and out, and just find what meditation or what breathing, focused breathing works for you. And then I know that that today, going inside, especially in a work environment with others around, is not always easy. But I do invite you to find a time and a place and a way that works for you to continue to work on minimizing your stress and ultimately staying heart healthy. So I just guess I want to ask if anybody has any questions or thoughts about anything we talked about today.
So as a reminder, questions will go in the chat. We could take one or two. And while you were typing, I just want to tell Danielle how much I appreciated this. And I'm always very cognizant, as a member of the Healthy Ulster Council and so many of the other meetings that we are privileged to be at, working in the fields that we do, that actually help us personally. We're helping others, but this has helped me tremendously as well. And, just reminding ourselves to take this time in our lives to really relax and be cognizant and meditate and do yoga and move, and reminding me I need that sleep. So for sure. If I don't see any questions yet, but I do have a comment from Ninette, just seconding that your presentation was very much appreciated. And again, for all of us, becoming healthy ourselves in our very, very busy lives, really appreciated. We have a comment from Vin as well. A whole person and a whole life approach is a key to a wellness. And it was a great presentation. And Christine Noble also said, thank you for the excellent presentation. So thank you so much today for joining us. We're getting more thank yous in the box. Again, I'm so privileged to have taken part in this presentation, and let us know at the Healthy Ulster Council how we can help you get this word out. We would love to see more people benefit from this. Perfect. I'm going to move us on into the next part of our presentation. We had our movement break, just reminding everyone, and I'll remind Danielle as well, the Healthy Ulster Google group that many of you are a part of. And if you are not already a part of it, after this meeting, sometime in the next week or two, I will check to see who's not that attended today and invite you to join. But you can share things directly with each other. So if Danielle wanted to share more information with all of you, she could just post that right to the Healthy Ulster Google group. And that is there for you to share information and also to work together. These are just some quick tips we'll go over really quickly, just so that when you are joined, or if you are a member, you can always change your display name. When you go in, it's just your email that goes in. So if you want to add your name to that so people know who you are, you can change that. And you can adjust your subscription or leave the group at any time. You do that under membership settings. I also wanted to very briefly discuss coming up, and maybe if Ninette, I'm going to stop sharing in a second and you can bring up, we're going to do a quick Jamboard. One of the collective action things that we do, we get together as Healthy Ulster Council members. We get together for professional development, which we had much of today, usually a couple of presentations. We also get together for networking, which we'll be doing shortly, but also collective action as a group. So I'm going to stop sharing, and if Ninette can bring up the Google Jamboard just to see who here in your organization has a healthy meeting policy. That's something we can work on this year, making sure that our meetings in our own organizations are healthy meetings. And the Center for Science Interest, I'm not going to get it right, Science Interest has a great toolkit for helping us to do that. So if you're able to share that, Ninette, if not, let me know, I'll pull it up.
Oh, I put it in the chat. Do you want me to put it?
Yeah, if you could also share it on the screen. So in the chat, if everyone can go to that Jamboard connection. So if you click on that, you will also be on the same thing on this screen that Ninette is on. This is the live version. And this is a question for all of you. It will help us as we look at this. If your organization has a healthy meeting policy, and the way that Jamboard works is these are like little sticky notes. And if you go over to the left, you can pull one up and bring it over. So I can actually pick up a sticky note and start typing in it. So that's how you would do that. And Ninette can put anything in. So you would want the name of your organization, and then you would also want yes or no. So that's what you're going to type in that when you click on it. And I'll do the same thing. And I'll just actually, all you have to do is click on the link in the chat and you're in the same place, and we can all watch it as well on in real time. So I would click on my, my Post-it, and I'll be typing in one as well. And I have to go back because I forgot to put yes or no, but I can edit it and add yes. So if everybody could just put their name and their organization in there, and we can kind of gather it that way. So we do have a healthy meeting policy, but it'd be good to know if you do or you don't, because we have examples of them and we can kind of talk about that over the course of the year. It'd be great if we could say at the end of this year that all of our participating organizations have a healthy meeting policy, which would be awesome. So we can kind of watch this happening in real time. We'll give it just another minute. And I'm going to say that you can add to this at any time using this link. So if you just either save it to your favorites or just keep it open after the meeting, you can still add more sticky notes to this. So we're just kind of looking to see all the organizations that are here, that everybody answers the question whether or not you have a healthy meeting policy. And I think we've got quite a few. I know there's a lot of people that are from the same organizations. So we can say yes or no. And Ninette, you could stop sharing right now. I'm going to move on, but those of you who have the link open can continue to put your answers in the screen. And then I'll just tell you a little bit more about healthy meeting policies. So this is the, whoops, I just moved there we go. So again, this comes from the Center for Scientific Interest, and there's a healthy meeting toolkit. And Nina, if you could just put maybe the model healthy meeting pledge, we don't have time to go over all of it today. That would be the third link into the chat so people can look at it and or maybe share it on the screen. I'll stop sharing, and if you could also share that on the screen. And in our next meeting, we'll talk about this a little more, and I'll share more through Google Groups so that you all can take a look at this and we can start thinking about how we might introduce this to our organizations if you haven't already, if you don't have a healthy meeting policy. And if you do, there are ways that sometimes you can bolster it up and make it even better. So this is kind of a pledge to either have a standard healthy meeting or a superior healthy meeting. There's lots in the toolkit that tells you all sorts of ideas and how to have a healthy meeting, especially if you're working with a conference and you're in charge of running it, or even our smaller meetings right in our own organizations, or if we're hosting a meeting for other organizations. So things you want to include. And then at the end of this, it includes also some sustainability ideas, packaging, reducing it, that sort of thing. At the end, if you can get your organizational signature from whoever your director is, if you're the director or you have another director, this is an example. You may have another way of doing a policy or adding a policy to your organization, which is fine. But we're just trying to be sure that we kind of institute this across the board and maybe learn from each other and what's in our policies. So that's something we'd like to work on over the course of this year. Any questions? Okay, Ninette, could you stop sharing at this time? And I will share again where we were. So we'll be talking about that again at the May meeting. And again, I'll send out more information through the Healthy Google group, Healthy Ulster Google group. So I just want to move us right into networking, because we've got the rest of our meeting to actually share some of the programs that are happening in our own organizations and talk about it. So the rules for engagement here is I'll call upon you to share. You're going to say who you are in your organization and share briefly about an upcoming event or program you'd like to share. Focus on a program or event for your organization, not like everything about it, because you have like a minute or so to kind of do that. But You can use the chat to share more details, links to your website, more things that you want people to know. So, whoops, I went too far. And I'm just going to let you start doing that. Let's go for it. So I'm going to call on Danielle Chianco. And if I said that wrong, let me know.
Hi, everyone. This is Danielle Ciencio from Ellenville Regional Hospital. So I am a community health worker here. I work with Tanya Stokes with the substance use disorder. So I work with the Project Rescue and the harm reduction like Victoria was presenting today. Oh,
Great, thank you. I'll move on to Ninette.
Thank you, Melinda. I have one quick thing. I was just trying to find a link to it. There are some free trainings geared towards educators, parents, anybody in school wellness. I'm gonna, let me see, post it here. Oh, that's the wrong one. So sorry. It's coming up April 6th. They have a whole series. It looks really great. One's on school wellness, one's on physical activity, and one I believe is on social emotional health. So if anybody's interested, you can follow that link that I just posted, the last one there. Thank you.
Awesome, thank you. Isis.
Hi, everyone. My name is Isis Benitez, and I am the community health promoter for Planned Parenthood of Greater New York. Just a few things. So first, we are hiring, and I did put our website, our link to the website, to our hiring website in the chat. And also, I am still here. We're still doing outreach in Kingston. We're trying to do everything that we can. We are upgrading to begin doing workshops a little more. So if folks want any like birth control workshops, STI workshops, please feel free to reach out to me, services workshops, anything like that. Please feel free to reach out to me. I put all my contact information in the chat. Also, we are handing out hygiene kits now also. They have toothpaste, toothbrush, shampoo, conditioner, deodorant, and those will be coming with me. So if anyone knows anyone that needs anything like that, please feel free to reach out to me. Don't hesitate. We're handing those out, as well as safety kits still too, which are the mask and hand sanitizer and the chapstick in it. So please don't hesitate to reach out. Also, I just wanted to add, like Victoria said, she received condoms from Planned Parenthood. We're not like the typical partner that people think of when it comes to like recovery and things like that, but we're a partner in general, and we're here to try to help in any way, shape, or form, whether it is giving condoms, whether it is just partnering and helping out in any way, shape, or form, like just being a helping hand or volunteering, anything like that. So please don't hesitate to reach out to me for anything at all in terms of just being there to help. And yeah, with that, I will say thank you.
Great, thank you so much. Katie.
Hi everyone, I am Katie Sheen Lopez. I'm the regional farm to school coordinator for at Cornell Cooperative Extension. I cover a 6-county region working with food service directors. I have no events or anything to share except that the Kingston District School Wellness Committee, which I also facilitate, has been rescheduled because of yesterday's snow day, and it will be next Thursday, St. Patrick's Day, actually. So if anyone is interested in attending those meetings in general, please reach out to me. Thanks.
Great, thank you. Maria.
Hi, I'm Maria Reidelbach. I've been working on a climate change cookbook with Cornell Cooperative Extension, Ulster County. And we've been doing a series of classes. So if you want to have a little break, have some fun and eat something yummy, you can join us for our March 23rd class, Quick Fruit and Nut Bread. It's nothing like fruit bread. So don't be afraid. It's a quick fruit and nut loaf. I'll put the link to sign up for the free Zoom class in the chat. And it's been great meeting you all.
Awesome, thank you. Stacy.
Hey there. So let's see. I just wanted to put a plug out there for the Poison Prevention Week. That's one of the health observances that are happening, and our Upstate Poison Control Center wants to make sure that everybody is posting that phone number for their clients to utilize whenever necessary. I'll put that in the chat. For preparedness, on our social media today, we did a post about checking your stocks. So that would be any emergency supplies that you would have ready for storms or whatever might hit us, making sure those are up to date and not expired. And the best time to do that would be maybe twice a year when you're preparing for daylight savings time and changing your clocks. You could also check that battery in the smoke detector and the CO2 batteries as well for safety. I wanted to say that COVID, is sort of winding down. We're seeing, less of it. People are unmasking, but we still want to remind folks that when they feel unwell, it is recommended to stay home, get tested for COVID if you're experiencing any symptoms, and certainly wear that mask when you're not feeling well, just to prevent any spread. We do have some surgical masks available. So if you're having events and you want to reach out to me, I would love to get them to you for your clients. They come in a nice hypoallergenic, bacteria-free plastic container, and there's 5 paper masks per unit. So that's a nice little giveaway that we're offering. And we will be doing a survey soon, so stay tuned and we'll send that link out to you so that you can get that out to your participants and clients as well. We look forward to working with you on that. So that's it for now. Thank you.
Great, thank you. Yvonne.
Hello, everyone. My name is Yvonne Crichton. I'm from the Institute of Family Health. My position is Community Engagement Coordinator. I am currently working with the MITCH program, which is the Maternity and Infant Community Health Collaborative, and the Healthy Family of Dutchess County. And I will be bringing that program to Ulster County soon. And that's about it.
Great, thank you. Jessica.
Hi, I'm Jessica Kennedy. I'm the Youth Engagement Coordinator for TFAC Tobacco Free Action Communities. I run our reality check program. We don't have too much, but there is a reality check. Sorry, I'm not phrasing it well. At the end of this month, we highlight smoke-free movies. So we're going to have a statewide event. And I will make sure to get that information out to the Google group, because there are some opportunities for youth and adults, doesn't matter, to participate. And we're showing virtually 101 Dalmatians and also Cruella to kind of compare and contrast those. And we're going to have like a trivia Thursday and that kind of thing. So just something fun to do. So I'll make sure to pass that info along.
That's great. Thank you. Christine.
Oh, sorry. Can you hear me?
We can.
Okay, sorry. Anyway, you can just go on the county website at the Office for the Aging. We're starting our lunch and learns again. And I know this month we have one on the 22nd. It's fostering psychological well-being for seniors at the senior hub right next door to us. But every month now we'll be having one. It provides a lunch, and then we have a presenter and time for questions, and a movie every once in a while at the Rosendale Theater. So we're picking up some of our activities again, and you can check them all out on our website. Thank you.
Thanks, Christine. Marge?
Hi, this is Marge Gagnon. I'm a registered nurse, and tagging on to the Ulster County Office for Aging, I wanted to mention that we will be starting 2 Tai Chi classes coming up, one on April 5th from 1:30 to 2:30 at the Marbletown Park, and the second one at the Robert Post Park starting May 4th, 1:30 to 2:30, and those are on Wednesdays and Fridays, and they're probably not up on the website yet, You can register by phone 845-340-3456.
Great, thank you. Itzel.
Hello, can you guys hear me?
I can.
Hi, I'm Itzel. I'm the new wellness counselor here at the Mental Health Association in Ulster County. So I just started last week, so I'm getting the hang of things and being comfortable in this position. Any events, I know that by the end of the month, we're expecting to bring back some of the support groups that we had on hold. I know that there's going to be another wellness counselor starting next week. So we're hoping to bring up more even new support groups by the end of the month. And thank you for this presentation.
Thank you. Vin.
Hi, everyone. Sorry, my camera's, I didn't bring my laptop in with me today, but I was wondering if I could share my screen for just a quick second. Can I do that?
Yeah, I have to make you a co-host, so hold on a second.
Okay.
Danielle, while I'm doing that, do you want to share the Heart Walk?
Sure. Yep. Coming up on April 30th, we are back in person for our Duchess and Ulster Heart Walk. We'll be doing a rolling start from 9 to 11 a.m. at the walkway over the Hudson. So I would just invite you guys to check out our website, get a team together, friends and family, kids are invited. You can even bring dogs on the walkway. So come out and get some activity on April 30th with the American Heart Association.
Great, thank you. Okay, Vin, you can share now.
I may have shown this before, and forgive me if you've already seen it, but for the last year, we've been engaging students from all over Ulster County through a CDC, New York State National Association of County Health Officials grant. And it's a student created peer-to-peer prevention messaging campaign. This is just but one element of it. This is a billboard and bus ad design. There are radio ads, there are videos, social media elements, and more. And there's a website set up, but this is a great billboard design that the students came up with. And this tagline, "Where do you see yourself?" It's really designed for primary prevention. And there's a website set up at ucprevention.org. So you're welcome to go there. I think that the students really knocked it out of the park. They really did a great job. The other thing I wanted to say was that I have been collaborating with Scenic Hudson. I had the executive director, Seth McGee, on our radio program a couple of months back on climate change. It was such a great conversation that I called Seth up and said, we should be doing more of this. So we're working on creating a climate change minute that will run on radio stations from the Capital District to Westchester. Climate Change Minute will be like a poignant fact about climate change. Like, did you know that the Hudson River is projected to rise 6 feet within the next century? So here's what Scenic Hudson or another entity is doing about it. Here's what you can do, listener, and here's where you can go for more information. So we've been working on that project and we hope to get it launched by the summer. And it's really exciting because we will be showcasing all kinds of organizations, nonprofits, environmental organizations, private sector, you name it, and really, vastly increasing the outreach and awareness of climate change.
That's great. Thank you. Thank you for sharing that. I think we had everybody. If I didn't reach out to you, do let me know so that we can give you a chance. We have one last thing we do before we close the meeting, and that's really sort of our evaluation. We'll be bringing up one more Jamboard just for you to share something that you learned at today's meeting, and that'll be our evaluation for today. Before I do that, I just wanted to share also that our next meeting will be held on Thursday, May 12th from 2 to 3:30, and that you can visit healthyulstercounty.org for more information. And meeting notes are now posted at Cornell Cooperative Extension under the Healthy Ulster Council. So you'll be able to see meeting notes there, and I'll be sharing the PowerPoint presentations and meeting notes also through Healthy Ulster Google Groups.